everybody, it's Rita at Gold Medical Jobs, and it's Monday. I'm a little late, and I plan on seeing you a couple of times this week. And I think we talked, yeah, get my face on the camera there. Hey, yeah, I'm managing without my technical. I've been through 2 computers today. So anyway, here we go. Last week I said we'd talk a little bit about nursing salaries because as much as we love what we do and are committed to our nursing careers, it's kind of interesting to anticipate your living and how you're going to manage and what are the opportunities to you financially. So you'll hear a lot, and particularly there's a lot of, so for example, a state that has a need for 10,000 nurses and already has, I'm just throwing crazy numbers out, but say there's a state that needs 10,000 nurses for their population in their hospitals, and they have in the state 9,900. Okay, so there's not a huge need. They need 100 nurses and they need backup for people retiring and getting sick, but that's 100 needs. And compared to a state that maybe needs 50,000 nurses or 60,000 nurses and only has 40,000. So that need is higher. And so their draw and their salary and their administration and their labor board is going to look at things differently. So having said that, you're going to see differences from state to state, from country to country, and so forth. So, and it's going to vary for the position too, because, for example, labor and delivery is a huge need, and the nurses stay in that career. Nurses that do labor and delivery love it, and they stay there, and so getting into those positions is wonderful and exciting, and the need for those positions they're considered a specialty. I mean, any in my opinion, every area of nursing is a specialty and requires certain skills and so forth. But some of the more intense areas like labor and delivery, I actually just was having brunch with 2 wonderful friends yesterday, and a friend of one of my friends, her friend had twins, and when we started our brunch, the mother was in critical condition, the babies were all right, and by the time we finished our brunch, the mother had passed. So things can go very critically wrong in labor and delivery, and that's a terrible, terrible, keep a good thought for that poor family. But when things go wrong in labor and delivery, things go critically wrong. And so nurses in labor and delivery usually carry additional certificates, A1s, and advanced life support, and neonatal advanced life support. People in the ER carry special certifications, people in the NICU and the ICU. So those areas, they kind of get that, I'm doing italics, they kind of get that specialty title because of the special certifications. But nursing is a specialty. The fan is blowing every little hair. Maybe I'll turn it off. Maybe not. It's too hot. But every area is a specialty, and there's very fine skills and so forth for all of those specialties. So having said that, I'm just going to give you a broad idea that you can Google online to the let's see, any labor statistics will give you an idea. And then most salaries are public knowledge. So if you're, for example, looking at New Hampshire or looking at North Dakota, you can search for public hospitals, private hospitals in North Dakota or New Hampshire. I don't know where those popped into my head, but they're very different. North Dakota, New Hampshire. One's way far to the east, and one's wherever it is. I don't know exactly where it is because I'm geographically compromised. But anyway, you can get actual salaries. So what I'm going to talk about is just briefly broad salaries. So I'll start with the two highest paying, and that's exciting. But know that the cost of living in these two states is very, very high. So top of the list, surprisingly to me, since I've lived here in Southern California, top of the list is California. California boasts salaries at over 100,000. So 101,000. What does that boil down to on an hourly rate? That's somewhere in the high 40s, $48 to $50 an hour. It will vary from hospital to hospital, from the middle part of the state, the northern part of the state, the southern part of the state. But California, the average salary is 101,000. And that statistic is a labor statistic, okay, from the labor board. The next highest state is Hawaii. Okay, I'm doing the hula now. Hawaii is up there too, and they are, what did I write down for Hawaii? They're over 90,000. So there you go. Those are two highest rates. Another high rate for nurses, and this could be in a hospital clinical setting. This could be in a outpatient clinic. It could be in a case manager position. A lot of nurses are needed for, and this is definitely a specialty, and it's not for everybody. It requires a lot of coordination and understanding of programs and so forth. But that is, I don't even know if I'm saying it right, case managers. But the nurses that, when a patient is ready to be discharged and needs placement, I don't know why that term is not coming to me right now, but those nurses are a type of case manager. They have to work with the hospital, the physicians, because they need doctor's orders, they need plans of care and so forth for wherever that patient is headed. Say they're headed to rehab for physical therapy on a hip replacement, or they're headed to a memory care facility, or they're headed to another state. Okay, so that requires a lot of coordination, a lot of knowledge, specialized knowledge. Why my little camera? Oh, there, that's better. Oh, hello. We're closer and we're centered. Okay, so those are some travel positions. Many, many travel positions are needed, and that would be, let's see, telemetry nurses, cardiac nurses, intensive care, ER, med-surg nurses, oncology nurses, all kinds of nurses are needed around the nation, and travel companies help the gaps, right? And it is actually a necessary commodity and an important part of any healthcare organization's budget. Okay, so there's a budget to hire people. There's a budget to, I'm sorry, there's little hairs blowing all over me. There's budgets for employees, full-time employees, part-time employees. There's budgets for per diem employees, meaning as needed. Usually per diem employees will sign up for X amount of shifts per week or per month or per pay period. I have a friend, she was very fortunate that her district hospital hired her many years ago. She's been on staff, really, I think she's pushing 30 years. And she was hired as a 2/3 employee. The hospital had gone to 12-hour shifts, and her pay period is every 2 weeks. And she signed up for this 2/3. So instead of working 3 out of 3 shifts a week, she works 2 out of 2 and is a excuse me, I can't say, a benefited part-time employee. And she's hanging out till her Social Security starts, and she's fabulous and saves lives all the time. And so that is a type of part-time position. But anyway, there are budgets at all the different hospitals, the private and the public and the district and the corporate, the big organizations, the HMOs and so forth. Kaiser is a huge, huge healthcare organization throughout the United States. And so their needs and their budgets will include all those salaried employees, plus a budget for daily as needed. And like say the ER fills up overnight and they're thinking, oh goodness, we've had X amount of patients in our ER. We've had, hundreds of admits over the night, and some are going to be saying, let's bump up an extra nurse in the ICU, an extra nurse in the ER, and some extra CNAs to do some sitting and filling in as these patients are coming in and being moved around the hospital. Maybe some will get discharged, but say that ER filled up so heavily in the last couple of hours of the night shift, they start planning for the day shift. And that's when they would bring in the per diem, the agency nurses, okay? And then there's also travel nurses, where they anticipate their needs based on however they look at it, a fiscal year, they look month by month, they look at last January and February when the flu hit and so forth. So travel nurses are brought into the hospitals, and as well as clinics. Clinics are a growing concern. Most businesses are a growing concern because we have a growing population and so forth. So travel nurses are needed across the board. And I'm going to quote some salaries, but take it with a pinch of salt. So this hair, a travel nurse could potentially make, a travel nurse usually is brought in for a 13-week assignment. So that's about 90 days. And 13 weeks assignments are generally, they'll quote this is how much you'll make for your 13 weeks. But then when you break it down to weekly, it may be just under $2,000 a week, which is a really substantial rate. And but you have to understand that that salary is combined with stipends for an apartment and relocation for those 13 weeks and living expenses, and then salary. So it can be broken down into, say, $15 an hour as a salary and maybe $20 an hour for that stipend. And that's good and bad news because the stipend often is not taxed. Those cost of living, the apartment, the car, and so forth are not necessarily taxed, and you're covered. Usually you have benefits that cover your medical, health, and so forth for those 13 weeks. You become an employee of the travel company, and so you're sort of looked after and taken care of during that time. And that can be really attractive to nurses that are looking about relocating or really enjoy traveling a lot. Maybe their commitments, they don't have a pet at the moment. Maybe their spouse is retired and can travel with them. Their children may be grown, or maybe they have a child in a state far away. Say they live in the Midwest and they have a child or two in another state like California or Massachusetts or whatever. It's an opportunity to go for 13 weeks to get closer to your adult child and maybe a grandchild and so forth. So travel for many, many reasons is an attractive opportunity for nurses and healthcare personnel, many other healthcare personnel, lots and lots in the surgical area, labor and delivery, so technicians and therapists in those areas, physicians, there's lots of travel opportunities. But the 13-week travel assignments that I'm familiar with are primarily for nurses, and you can probably make about $2,000 a week, you can maybe make more. So for 90 days, you can come home with a salary of anywhere between 20,000 and 40,000 or even 50,000. But look closely at the contracts, talk to your recruiters, and find out what's actually going to be money you receive. You know, because if you're receiving an apartment, you may or may not get cash for that. Every travel company is going to work a little differently. So that sounds pretty terrific. If the highest salary in the country in California is approximately $101,000 a year, to make $40,000 in 90 days is like, wow. Maybe I'll just work another 90 days and take the rest of the year off. It doesn't really work that way, okay? You have to travel. Sometimes during that travel, you have to travel back home to see your folks, or maybe somebody's getting married. There's just so many pieces to it. And it's not for everybody, but I actually, my last job, I was a nursing manager for travel nurses. And so it really was a absolutely terrific way of life for many nurses. And some nurses were just trying it out, and some nurses did a little bit of it here and there, and then hung on to their full-time jobs elsewhere. So that's another thing to think about. All right, so let's just go through a couple of the states, and then I'll let you go, and I'll see you again on Wednesday, and hopefully our friend Mary, my wonderful friend that's been a nurse, we've been a nurse almost exactly the same amount of time. We started in the 70s, if you can believe that. 1970s, it's 2019, good grief. Anyway, so for a lot of the Midwest, the Dakotas, I saw a lot of Salaries, Montana, Utah. I'm not going to go through all 50 states, but you can see Salaries in those areas. So Iowa, Indiana, North Dakota, South Dakota, Utah, Montana, blah, blah, blah. Most of those states, you're going to see anywhere from 55,000 to, how high did we go? 58, 62. Okay, so from 55, that's a pretty big spread. And again, that will vary from organization to organization to clinics and hospitals. It's going to vary quite a bit. You'll see Salaries from 55,000 up to 62,000. It starts to get higher on the, let's see, starting to get closer to the east. Vermont and New Hampshire are up in the 65 to 67,000 range. So you're looking at anywhere from $31 to $32 an hour. And then if it's 12 hours, it might be time and a half after 8, depending whether you're salaried, traveling, per diem, part-time. Check with the labor boards before you accept any salary, because if you're going in, for example, as a per diem employee, you may be working at Hospital A on Monday, Hospital B on Tuesday, back at Hospital A on Monday, and Hospital C by Friday. You may be working an 8-hour shift on Monday and Tuesday and a 12-hour shift on Wednesday at different hospitals. So the labor boards will normally say you should be paid your time and a half in hours per day. If you're salaried on staff, you could have a contract where you make the basic salary, right? $50,000 a year, $60,000 a year, $100,000 a year if you're lucky. So you may not see that time and a half. Maybe if you work an extra shift, you could talk to your recruiter, your HR person, your whoever's hiring you to clarify how that works. Because I know nurses that have their regular jobs and then sort of moonlight, work as a per diem for an agency, you know, a couple of shifts a month for Christmas funds, whatever, to get that car fixed or whatever. And they work for an agency because they will make time and a half. So they like their job, they like their community, wherever they're working, but they may take on another job, or maybe not a financial reason, maybe a reason that, you know, I've been working in ICU for years, but I was an ER nurse or I was a tele nurse, and I don't want to lose those skills. Whatever your reasoning is, find out before you accept your position, before you sign contracts, if you're getting time and a half after 8 hours, if you're getting any benefits, is that included in the salary, etc. Okay, so we've talked about some of the middle states, the Midwest, and going east towards the colder states, which are Vermont and New Hampshire. Who else did I mention? Montana. Let's talk about closer to California. Oh, well, let's finish up the West Coast. I mean, the East Coast. Let's go all the way to New York and to Massachusetts. Those states have pretty high salaries. Actually, Massachusetts is quite high at over $88,000 a year. So between $88,000 and $89,000 are the salaries I've seen when I looked up the labor statistics. So that puts you at about 40-something an hour. And then New York is in the high 70s and 80s. So that puts you pretty close to 38, 40, and so forth an hour. And that's as far east as I went. I can't remember Maine. I didn't jot it on my little notes. But, you know, Maine, Rhode Island, they're smaller populated states, but it just depends on the need, okay? And then who did I want to mention? Did I mention Hawaii? Oh, Nevada. Well, Hawaii is in the high 90s, and Hawaii is bringing in travelers because they have a lot of visitors. I would love to visit Hawaii. It's been a very long time. My daughter is about to have a baby, and we went when she was, I don't even think she was in junior high yet. She was quite young. So I'd love to visit Hawaii. Beautiful state. Anyway, beautiful state of islands. So they're in the high 90s, and their travel rates are pretty competitive because of the need for all the travelers, travel vacationers, people with timeshares, and unfortunately people get sick and need hospitals. And so a lot of travel assignments there, a lot of growth in their hospitals. Kaiser has a concern there on Maui, I know, and I believe Hawaii. I'm not sure about the other islands. No, Oahu is the big island. Oahu is the most populated island. That's where Honolulu is. And then Maui, lots and lots of homes and second homes there, and growing population in Hawaii. So that state is pretty high. The highest is California. Second highest is Hawaii and Alaska. Alaska's up in the high 80s to 90, and I think, I'm not sure about the rate of the population in these states, the rate of growth. I just feel like in general, the population is growing. It's certainly growing in California. And a lot of states, because people change and leave the states. So we talked about those salaries. So salaries for nurses are going to be anywhere from $26.50, say at the low end, to up to about $50 an hour and more at the higher end. I'm sure there's some very special areas. Another big area in the outpatient realm is plastics and plastic surgeries and enhancement surgeries, what do I want to say? Like, the skincare, the sort of spa, the doctor's spas, they require doctors and sometimes nurses in those facilities. I know the vein industry, intervention for veins and varicose veins and so forth. So you may see some real spikes in salaries in some of those areas. Outpatient surgery is a huge area that staffs and employs many nurses and many therapists, surgical techs and radiology techs, and sometimes respiratory therapists are needed in some of these outpatient facilities. So lots and lots of opportunities. I'd love to hear what you have to say about salaries, and if you want to share, that would help me, because I'm just giving general broad statistics, but I think it's good to talk about, right? And then another huge subject would be the benefits. What do you consider a benefit? I mean, I'd like 3 or 4 weeks paid vacation, huh? Yeah, okay, well, you can include maybe 5, 6, 7, 8 holidays as part of your paid time off. So look carefully at that. And I'm talking to all the nurses out there. I respect you. I'm with you. There's lots of jobs at Gold Medical that you can look at, and just ask your questions because you're in the driver's seat. Okay, nurses, take care. Have a beautiful week. It's Monday. I think it's the 16th. Let me see if my phone will tell me the date. I think it's the 16th. Hello, phone. It's September 16th. Have a great day. I'll see you Wednesday. Look for me on YouTube and where else? Twitter, Facebook. Okay, take care. Bye-bye. Oh, I know there was another place. Twitter, LinkedIn, Facebook.